According to the Center for Disease Control and Prevention, or the CDC, in the early 1950s, before polio vaccines were available, polio outbreaks caused more than 15,000 cases of paralysis each year in the U.S. In later years, the polio vaccine is developed. The number of cases fell steadily until there were less than 10 cases reported in the U.S. in the 1970s. In 1979, this often crippling and fatal disease was declared eradicated in the U.S. by the CDC. Unfortunately, since that time, there have been polio cases brought into the country by unvaccinated foreign travelers. This is one example of a disease that can be prevented using vaccinations. Other illnesses such as measles, mumps, rubella, chickenpox, tetanus, and diphtheria have vaccinations that are commonly recommended for the United States children. Vaccinations are key to eliminating not just polio, but other catastrophic diseases as well. Vaccinations are usually an inactive or weakened virus taken into the body to activate the immune system response to create antibodies. Depending on the vaccine, they can be given from an early age at multiple doses to build up the antibodies from infancy. In later years, booster shots are given to keep levels high enough to prevent disease. There are several advantages to vaccinating children. Most importantly, vaccines save lives. In the case of polio, the harmful effects of the disease traumatized the nation. Children died or serious physical issues occurred. Measles, mumps, and other similar diseases were common childhood diseases. Even though the side effects of these diseases are not as severe as others, they can cause unnecessary health issues. Even though chickenpox is a disease that many of our parents had, that can be prevented with a vaccine. This also prevents painful shingles in elderly adults. When vaccines are given to the vast majority of the population, it is less likely an outbreak will occur, which protects the vulnerable individuals. These are people that have serious health issues or are unable to be vaccinated, such as newborn infants or those with allergies to vaccines. Vaccines protect future generations for multiple reasons. Vaccinated pregnant women are able to pass the vaccination to prenatal infants, and antibodies can protect the infant in the womb. In addition, some viruses can cause birth defects, so vaccinated mothers are more likely to have healthy babies. Hopefully, diseases are eradicated in the future and no longer a concern to future offspring. There are many more benefits to vaccinations. Sadly, an increased number of parents are deciding against vaccinating their little ones. Parents fear medical side effects of vaccines. There are the possibilities of allergic reactions, seizures, or other brain damage. There are even groups that related vaccines to developmental disabilities such as autism and ADHD or learning disabilities. Furthermore, vaccines contain a variety of potential harmful chemical components. The most worrisome include mercury compounds, formaldehyde, and a vast array of unpronounceable chemicals. There are a few religious groups that oppose medical intervention. These parents believe that medicines and vaccinations show a lack of faith. They opt out of prescribed vaccinations due to their religious beliefs. While typically everyone has a right to raise his or her child as they see fit, refusing vaccinations has a lasting impact that goes far beyond one child or one single family. As people forget about the complications of a disease, it makes it easier for parents to not rationalize vaccinating their children. Although there is a possibility for harmful side effects with any medical treatment, the CDC holds that the potential for side effects is less than the benefits of vaccination. That's what it says. They estimated that 732,000 children were saved from death, and 322 million cases of childhood illnesses were prevented between 1994 and 2014 due to these vaccinations. Further, some side effects such as autism have been incorrectly linked to vaccines. They have questionable chemical ingredients found in vaccines can be harmful in large doses. In fact, the FDA requires 10 or more years of testing prior to public use of a new vaccine to prevent any overdoses of these questionable chemicals. It is nearly impossible to refute someone's religious beliefs. In small numbers, these families can be protected by the vaccination of the rest of the population. This makes it even more important for others to maintain proper vaccinations. Disease causes serious issues in families. Luckily, science and medicine have allowed us a way to prevent further spread. Vaccinations are important in preventing illnesses and trauma caused by these diseases. The more people in a community receive the vaccination for a disease, the less likely an outbreak will occur. Finally, we can provide a safer future for our children by reducing or eliminating these diseases through vaccines.